Hi, my name is April Henson, and I'm currently a pharmacist at Legacy Pharmacy. I would say that Legacy serves communities loud and proud. And we don't really shy away from things that most people would that make them uncomfortable or that they don't really want to address. It's something that we go forward and we tackle it head on. And it's been so fun for me because I haven't tackled a lot of these issues before. So not only is it me doing this with Legacy, it's me doing it for myself too. So it's been really fun to just really dive in and not be scared, not be ashamed, and really try to help people that need our help. For me, the biggest thing about Legacy that interested me was the fact that we were serving the underserved and disenfranchised populations at large, and we were being able to do that with a multidisciplinary team. Coming from traditional retail, we didn't really have as much access as I would like to have had in order to be able to make an impact on the patients that we were serving. And since I've been at Legacy, I feel like it's back and forth. We are able to just continue to make an impact with our patients because we have extreme access to not only the physicians that we're working with or the nurses that we're working with, but we have great access to financial services and eligibility to ensure that we make sure our patients are completely taken care of here at Legacy. With Legacy, to me, one of the other biggest differences that I've seen is that our answer is always yes, no matter what. Doesn't matter what your background is, doesn't matter what health condition you have, doesn't matter about, if you're rich, poor, in between, the answer is always gonna be yes. And I really appreciate that because I always felt like previously patients would fall through the gap or there would be no continuity of care because they feel like they don't have options. And here it's like, nope. There's a prior authorization, give me a little bit of time, we'll get it taken care of for you. So it's never that we're not gonna take care of you in whatever way that we can. The answer will always be yes. I actually was counseling. I had a PrEP patient that had just finished their PrEP visit. And during their PrEP visit, they were actually given news that they tested positive for an STI. And you could see when I was counseling, it was more so like he held his head down, like he was ashamed, and he just kept shaking his head. And I just kind of asked him as I finished counseling, I asked the typical questions, do you know what this medication is for, what we're trying to treat? And then we went over how to take it. And he continued to keep his head down and shake his head. And I was like, well, what's really wrong? And he was like, I'm really just ashamed that this happened to me. And I'm like, well, don't be, because you're human. Humans make mistakes, and it's not even necessarily a mistake because you're actually here. You're doing what you need to do as far as doing the PrEP and doing the things that you need to do, and that's why you found out. You were being the responsible patient, but now moving forward that, to take your precautions and to make sure that you're doing the things that you need to do for yourself in order to move forward. But this is nothing to be ashamed of. And I think that's the biggest thing with a lot of patients, especially our HIV patients who deal with stigma every day, is that a lot of things they feel like they should be embarrassed about. And I'm like, you shouldn't be embarrassed about that. I'm gonna help you through that. And if you have questions, you can always call us back and there's gonna be someone here that can answer any questions you have. But you've taken the biggest step in the fact that you're here and you're taking care of the things that you need to take care of.